Hello, I'm Joseph Alpert, editor-in-chief of the American Journal of Medicine, and I'm here today to call your attention to another really interesting and clinically relevant article in this month's journal. It's from Ladd et al., and it uses the Veterans Administration database, which, as you know, is a huge database with veterans with all kinds of illnesses, the diagnoses, the therapies, and so forth. And we've published interesting articles where people have explored specific conditions in the database. This one looks at patients with acute pancreatitis and looks at mortality and complications in them. And it turns out if patients had been using nonsteroidal anti-inflammatories, that's things like ibuprofen or naproxen and so forth, before they got their episode of pancreatitis, they actually did better. And these anti-inflammatory agents perhaps are keeping down some of the inflammation in pancreatitis. So, this is, of course, retrospective and it's association out of a database. But of course, what they suggest is it's time for a clinical trial, because clearly it would be a good idea then to put some patients on, of course, in a double-blind study on NSAIDs and the other group on placebo and see if it made a difference. I've taken care of a lot of patients with pancreatitis in the hospital, and it's nasty, a very nasty illness. So this is interesting that this database gave us some little clue as to possible therapy. Well, in any case, thanks for reading the American Journal of Medicine and staying in touch with us through our various social media, and look forward to talking with you next month.